Um, I'm a little bit lower on the totem pole than all of you probably. I'm also a mother who have, sorry, this is nerve-wracking. I'll just read what I wrote. My name is Jamie Cross, and I'm a Colorado Springs native. I'm 27 years old, and I'm a single mom of 3. I have battled with mental illness issues for as long as I can remember. Many family members within my family have similar struggles with mental health, from substance abuse in both my parents and my dad overdosing at 7, my mom being an alcoholic and not being in my life, and substance abuse in all my sisters, to narcissism, bipolar. My struggle just happened to be an eating disorder. I've struggled with an eating disorder since I was 16. Bulimia and anorexia have brought me to many, many low places in my life. Not many people know that an eating disorder is a mental health struggle, and it is 110%. And it needs to be brought up more. On top of an eating disorder, I've also struggled with borderline personality, SID, which is self-harm disorder, as well as the SI, which is known as suicide ideation. All these mental health battles have ruined many aspects of my life and have taken the sheer joy out of life itself, as well as having my life almost ending December 14th of 2019. I was dead upon arrival. These disorders have paralyzed most of my life due to a significant amount of abuse, neglect, sexual abuse, and verbal abuse in my life, and these disorders have taken place as monthly and even daily needs. As a single mother of 3 who also is a CNA, I have found that there are not many, if any, resources for most of these disorders, or for a single mom with these disorders. And for the ones that do exist, it would cause me to go bankrupt in order to attend, with no family support, as well as working as a CNA in an office and field work. And children who have also lived through tremendous amount of trauma. I adopted my 3-year-old niece from my sister. My mental health is easily compromised with an insurance with high deductibles and copays that are the same price as groceries for a month of a household of 3. Me seeking support, help, and treatment is very, very rare, if non-existent. More resources need to be established in the Springs. There are a couple EDC centers, eating disorder care centers in Denver, but the Springs are lacking. In order to be a better mother, a more successful CNA, and a recovered Jamie, we need more free DBT classes and more focused support for the disorders mentioned above. Eating disorders are so low on the totem pole of mental health, and they should not be. They should be higher than that. I've been hospitalized 4 times because I ruptured my esophagus. I was kicked out of college because I was so broken that I needed help, and no one really knew how to help me. For borderline personality, which is also really low on the totem pole of mental health, DBT classes are an amazing, amazing resources for people who struggle with it. Borderline personality comes from people who have suffered lifelong trauma and who are trying to figure out how to live outside that trauma as an adult. As for self-harm disorder, that is also low on the totem pole of mental health. And my 16-year-old who I've taken in recently also struggles with self-harming disorder. And it's not because we want to die, it's because we have pain that we don't know how to handle. And we don't have people who reach out in the appropriate way. For suicide ideation, as a mother, I get asked that a lot. How can a mother have suicide ideation? And if you're a mother who's grown up without a mother, it's hard not to. And so I feel like the stigmas also need to be treated with that as well. It's hard standing up here as a CNA and as a mom admitting these, especially with someone who struggles with it. So I asked for more resources. I asked for more free resources, not only for me, but for my 16-year-old and my 4-year-old niece, who is going to have to deal with similar things as she gets older. Thank you.